Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Good afternoon, Miss Schwinn.
Well, good afternoon, Doctor.
It sure is a beautiful day out there, isn't it?
Yeah, it is nice. Very nice.
By the way, I won't be here for the rest of the afternoon. Can you go ahead with your scheduled patients?
Well, where can I reach you, Doctor?
Well, I won't be near a phone, so just go ahead with your normally scheduled patients, okay?
Certainly is a nice day out today, isn't it?
Yes, yes it is.
Has there been any change in your medical history since you were last in?
Well, I've been tired, kind of unusually tired, and I have some kind of a sensation up in here that's strange. It has me a little bit concerned. It's not, really terribly painful, but it's just kind of odd.
It's probably because we haven't finished cleaning in that area. I'll bet that's it. Let's go ahead and try and see how it goes.
Fine. Good. Oh. Wow. Oh.
Can you tell me about it?
Oh, it's a pain. It's going up into my head.
I think that's from the instrument. Lots of times when the instrument touches the cementum, you get that sharp pain.
Oh no, it isn't that sensation. It's getting worse.
Can you?
Oh, it's really
what's it like?
excruciating. Oh, it really is dreadful.
Are you going to be okay?
Oh,
Listen,
I'm feeling a little faint.
lean your head forward a little bit. There, that's fine. Yeah, just lean forward. You keep leaning like that. I'm going to go call Dr. Doty. He takes care of our emergency situations when the dentist's out of the office.
The dentist isn't here?
How are you doing?
Oh, it's terribly painful.
can you lean
Oh,
back
it's
a
just
little?
dreadful. Oh, just terrible.
Let me take a
My
look
vision
here.
is blurred.
Let me take a look.
Oh,
I think that could be an abscess. Dr. Doty wasn't in the office, so he can't come over and help us.
what?
Dr. Doty, the man that takes care of our emergencies, wasn't in the office.
Well, I'll call another dentist.
Well, there is no one else. You see, Doctor and Dr. Doty have an agreement.
Well, can't you recommend someone?
Well, no, I'm not allowed to refer.
What shall I do? What are you going to do?
Miss Schwinn,
Yes, Doctor.
we have a serious problem on our hands. We have been notified that Mr. Johnson has a very advanced sublingual malignancy, and our records also indicate that you made an oral inspection on this 2 months ago and 6 months prior to that. It has also been established that Mr. Johnson has had this malignancy for at least a year. Well, what's the reason for all of this?
Well, Doctor, I thought that you were repeating those oral inspections.
But I delegated this responsibility to you, and I assumed you would carry it on out.
Well, I thought we had a system of checks and balances in this office. Hi, Doris. What are you doing
Sharon.
today on your day off?
Oh, I forgot to take my uniforms home, so I had to stop by this morning to pick them up.
It's really good to see you again. It seems like
That's
I
good
never
seeing you.
see you with you working 2 days and me working the opposite 3. Do you have a minute? I'm between patients. Do you
Yeah,
want to
sure,
sit down and
sure.
chat? Great, good. How have things been going for you?
Oh, I'm so excited about this position. I'm really thrilled about it. The other day I was scaling, and the patient was very, very uncomfortable. So I called in the dentist, and he taught me how to do an infiltration. And I was awfully nervous about doing it, but I did it, and the patient was comfortable, and the patient said he didn't feel a thing. And I'm sure I won't be as nervous the next time.
Good morning, Mrs. Schwinn.
Good morning, Doctor.
Welcome to the practice.
Thank you. It's nice to be here.
I see by our schedule here we have Mrs. Miller. She's a very nice patient. She's been coming to us for about 20 years now. She's subject to recall every 6 months.
Okay.
So here's the schedule.
Thank you. 6, 3, 8.
How do you do? How do you do, Miss Miller? How are we doing?
Just fine. I'm almost done with the perio charting. Would you like to see it?
Okay. Oh, you're doing very well. Continue on with prophylaxis.
Oh, wow, you're certainly doing an awful lot of scraping.
Mm-hmm. Yeah.
Oh, you're going beneath the gum, too. I've never had that done before. How long is this going to take?
Well, I'll be able to finish a quarter of your mouth today, 1 quadrant, and then when you leave today, you will need to make another appointment to come back. Doctor, did you notice that Mrs. Miller has generalized 6 to 8 millimeter pockets? She's really quite an advanced perio case.
Well, I don't know. I think that school that you went to kind of overemphasizes perio. In my opinion, perio surgery does more harm than it does good.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.